Welcome to another episode of What the Vet. It's a little different than before. We had some technical difficulties during the recordings of the episode that's getting ready to come out. So our intro got lost. So Amber and I are introducing Janelle, who is a registered nurse at the hospital that I work at. She took on a clinical educator role on the floor, and we figured she would be the perfect person to be able to come on, advocate for her peers, but also be able to listen to our side, especially with everything going on between registered nurses, veterinary technicians, as well as being called veterinary nurses. So without further ado, we're going to jump right on into it.
Also, these are literal opinions and thoughts of our own, and they are not meant to offend anybody. I just gotta throw that little disclaimer.
It's true. Like, honestly, this was like such good discussions that we were able to have and hear it from all sides. At one point, me, Amber, and Janelle all had differing views of opinions, and we all valued each other's opinions. So go in with that mentality, with an open mind. We love Janelle. She did an amazing job advocating for her side and letting us know how that side worked. So without further ado,
I guess the culture in the vet world with staffing, like, are you severely understaffed and constantly needing more vet techs, or is it fairly, like, what's the work-life balance in a scenario in the vet world? Not great?
We're in a long time. No, so pre-COVID, veterinary medicine wasn't doing too bad. I have seen trends change, again, since COVID, to where we are very understaffed in terms of technicians, receptionists, doctors. Our field in general is suffering. I think COVID, not as much as what you guys went through, but put us through the ringer because people were at home with their pets. They were noticing things they hadn't noticed before. Anxiety got worse. People became flat out aggressive and hard to deal with, especially with like curbside services and things like that. So a lot of us experienced quite a bit of compassion fatigue and burnout.
Yeah.
And a lot of this, we're done. We don't want to do it. And there's a lot of doctors that are leaving the field, technicians that are leaving the field. I had a technician that we worked with in a facility. She was a PCU and ICU nurse for one of the big universities. Phenomenal technician. And she says, I will never set foot back in a veterinary hospital. So we are hurting for staff right now.
I was going to say, I felt more threatened during COVID from clients than I ever have in any other setting, because we were in Florida on pavement next to some guy that had a gun in his car, and we're taking his dying animal away from him and saying he can't come into the hospital. And also like random naked homeless people coming in through the parking lot. So like it was, yeah, that happened on several occasions, both settings of both guns and naked homeless people. But I felt more threatened during those 3 years of COVID where we were in true lockdown than I did in any other situation compared.
How did COVID affect like the euthanasia process? For example, my husband and his brother have a 15-year-old German Shorthaired Pointer that needed to be put down, and it was during COVID. And at this veterinary clinic, they were not allowed to go back with him, and they wouldn't let them take Bo. Josh was like, I'm not gonna let my brother go die in there by himself. But was that standard for everyone? If your dog was, or animal, any form of animal, really, really ill, but you weren't allowed to be there in the room with them?
Yeah. So it was not the same for every clinic. Every clinic had their own little stipulations. But for the most part, if you wanted to be present for the euthanasia, but the two practices I worked for during that time, it was done outside. As much as 6 feet as you can do, so there were extension lines, they were holding them. It was not the best. It was not the best way to go out. It was not the best way to be supportive for the clients during that time. If their pet was, let's just say it was, a dog that had congestive heart failure, they're in the oxygen tank, the owners could come back and say goodbye, but they couldn't be in a room when we euthanized them because it was quote unquote enclosed, too enclosed. We tried to have them with them as much as possible, but we couldn't be next to them. And for the most part, thankfully during those situations, they were fairly understanding Mind you, it was Florida. There were some that weren't, but then it was, okay, Joyce, you're the tech in ICU. Are you comfortable with the owners coming back and dealing with this? And like, obviously, I'm going to say yes, but there were some that said no, that they weren't comfortable, and so they were excused, and another one is in their place during that.
I think
Yeah.
my first euthanasia during COVID, it was when we went in that first 2 weeks of lockdown. We had a family at the shelter whose dog was super sick. They brought him into us for help, and ultimately it was decided to euthanize. We had to go outside in full PPE. We were in full PPE, gloves, booties, everything outside to help these people with their pet to pass. Like it was rough. Like trying to navigate that initially. Like what do we do? Like, we can't take this pet away from this family, away from this kid, and tell them, oh, you're never going to see him again. But how do we facilitate this? How do we make this work?
Yeah.
So it was a set a precedent for a lot of things going through that situation.
Yeah,
You guys,
absolutely.
were you a nurse during COVID?
Yeah, I was a transplant nurse. I worked on a abdominal transplant floor, so kidney, liver, pancreas at any stage in their transplant. And I was fortunate to work at a facility where the ratios didn't change. They were very protective of our staffing. And I think the hardest part was we stopped doing elective transplants, but we were still doing emergent transplants. So when it was like dire, this person is going to die within the next certain amount of time if they don't get this organ, but families were still not allowed. And so that was really hard because we would have, like, for example, we had one lady come in for an emergent liver transplant and she died on the table, and her family was not able to come in prior to the surgery nor come in. We basically gave her loved ones her belongings in a bag in the parking lot of the hospital. And so you think that's just crazy to think about, that we were doing, it's so weird because I was a nurse pre-COVID as well. And I wouldn't have, I worked on a unit that was pre-COVID, was 2 patients to a room divided by a curtain. And downtown Phoenix, Arizona, you'd get upwards of 10, 15 people in a room, 5 people on this side of the curtain to see Mima, and 5 people on this side of the curtain to see cousin Jenny, and kids, babies, everything. And then COVID hit, and now post-COVID, if I hear like a kid's voice in the hospital, I'm like, why is there a child here? It's just weird to like. And then selfishly during COVID, not having visitors was nice per se, but it was extremely painful in those situations where they couldn't be involved in the care at all. And then that patient has a life-altering, I don't want to say side effect, but I can't think of the right word. Like something happens where the surgery doesn't go right and they need another procedure done, and they're stuck in the hospital for upwards of 5, 6, 7 months and no visitors at all. Like, that's crazy to think about. You're stuck in a hospital bed for several months and the only people you see are the healthcare staff, and they're covered in PPE. Like, you can't even see their face.
Yeah.
So definitely, I think the hardest part was the emergent transplants during COVID, when loved ones couldn't come in and see the patient before they went for the procedure, and then unfortunately if they lost their life, they never got to say goodbye, which is always depressing.
Yeah.
But I feel like post COVID, I don't know if people are just people, man. They just do the darndest things. But I feel like you're gonna get that one in any profession, but also when it comes to healthcare in general, whether we're talking about animals or humans, people are crazy.
They are.
So, and they fight for the things that they love. So,
Yes, I would say the people portion of your job, which is all of it, is one of the singular things that I said no to becoming a nurse. Is because, yes, in the veterinary world, you think you're going into the veterinary world to work with animals because we don't like people, but you end up only working with them about 25% of the time. The other part is all human side. We're going over the client education, taking a history, going over the checking in, checking out, all of that, and then just a little going over money. Like, I've given an estimate for a surgery, like post-op care surgery, of 10 grand, and I have to go over that with a guy who's a single parent with kids in their room, and I'm like, okay, let's see what we can do and go from there, because they don't insurance is getting better in the animal world, but when I first started 16 years ago, it wasn't. It wasn't a thing. It only helped with maybe some vaccines and that, but now it's getting better. Human side, you don't think money first necessarily. You think fixing the problem first and then, insurance and everything afterwards. But I'm trying to think of a very polite, politically correct way of the names that we were called, especially during Christmas time, when we're giving an estimate to fix a pet that it wasn't our fault that their pet is sick and needed surgery and needed critical care. And then they would get their kids involved because, I'm the Grinch that stole Christmas from them. And they're telling me, how could I be such an evil human being? I'm like, it's not my fault your pet ain't underwear. It's your underwear, not mine.
It belonged to your wife.
That didn't belong to your wife. And so, but, people are just, the audacity of them, I guess I can say, is a very polite way, is the audacity of the people on both sides, but then also the differences of it, because you think you're going into one field to help and really you're just getting bumped.
Is there like a mid-level in the vet world in between a vet tech and a veterinarian?
No, not yet. So you're thinking like a PA type deal, right?
Yeah, kind of like how in the healthcare we've got the doctor, the MD or the DO, and then you've got the RN and the LPN and CNAs, and then in between you've got your advanced practice practitioner, so NPs, PA.
Yeah, so the way it works right now is you have a veterinary assistant, veterinary technician, and then doctor. So you only have those three classes. And kennel staff is.
Is the vet assistant and the vet technician, are they this one and the same? Kind of like a CNA versus
yeah.
There's
correct.
different names for a CNA, patient care tech, CNA.
It would just be, so veterinary assistant is similar to a CNA, and then you have the vet tech, which is the LPN and the nurse combined pretty much. And then you have the next step as the doctor. There is the works, and it's not, I haven't paid much attention to it, Amber, since they first released it. Maybe you've heard more where they're getting it.
There's only one state right now, if I'm not mistaken, because I don't really keep up with it all that much, that has the mid-level, and I know that there are multiple other states that are shooting for a mid-level veterinary practitioner.
Yeah, so is it common practice? Absolutely not. It is brand spanking new in the vet world of it going through the works. Do I think it's going to take off? Not at first. Do I think it's needed? Absolutely.
Absolutely. 100%.
Yeah.
100%.
It's needed. It's like they're not doing procedures, but they can take the workload of, the yearly vaccines and looking at the skin lesions and being able to take that portion off of the veterinarian so they can then step in with the procedures that need to get done and things like that. So it's coming, it's happening, but hopefully it'll be more popular in 10 years, because that tends to be the sweet spot in vet med, is 10 year mark.
Yeah. So when you have an animal that is in need of a procedure, who has to go over that procedure with the owner? Is it the vet tech or is it the veterinarian, or does it matter? Like in the healthcare world, I'd be like, the provider's going to go over that with you. That's outside of my scope of practice. I might be able to answer questions that I feel comfortable answering, but as far as getting consent and the explanation of the procedure itself, is that expectation that the veterinary tech does that, or the veterinarian?
So I would say outside of one corporate facility, it is the veterinary technician. There is one practice where the veterinarians do most of all of that consent work, but all the other places, it is the veterinary technician that is getting the vitals, getting the history, going over the estimate, getting consent, and going over the process of what the pet is going to be doing. And then the vet will, either get on the phone with them or go person to person when the procedure is done, tell them how it goes, and then the veterinary technician follows up with, depending on the veterinarian's trust in that technician, they will calculate the drug doses, fill the drugs, and go over discharge and then check them out. So we do a big portion of it versus the doctor.
Dang.
So, yeah, there's been instances where, the doctor has taken the estimate to go over it, but like we're talking.
Yeah, so I know you guys had some stuff together, like similarities and differences and things like that. So like in the nursing world, right? And, I say nursing world, but how do let's talk about that for a second. How do you feel as a nurse about a veterinary technician being referred to as a veterinary nurse? I know there's a lot of controversy around that coming from both sides actually, but how do you feel about that title, if I may ask?
Honestly, I've never been asked that question. I did not know there was controversy over it, and my initial response is, well, they're not the same thing. Like, veterinary tech cares for animals, and a nurse cares for humans, and I don't think there's anything wrong with the difference in titles, but I'm also not the one in... Is it like the word technician that people are getting caught up in? Like the veterinary technicians don't like that word?
No, it's more or less like I've had conversations with human nurses, or I've seen, social media and things to where they'll say a veterinary technician is not a nurse, but in essence, a licensed or a registered veterinary technician is every bit of a nurse as much as you guys are. They go to school, they sit for their boards, they take their licensing exam, they draw blood, they administer medications, injections, take radiographs, do ultrasonography, process blood work. There's so many things that encompass of what a veterinary nurse / technician does.
But if somebody were to collapse in a grocery store, would a veterinary technician know how to handle that situation with a human being?
It depends. Yes, absolutely, because I've had training to do so. However, with an actual, like a veterinary technician, I guess it depends on the technician, but probably not to the depth that you guys were. But if we do the same, I say the same thing. If we do similar things day in and day out, but the difference in what we do is the species that we're treating. Why is a veterinary nurse not allowed to be, or is there an issue with a veterinary professional, say a technician, being called a veterinary nurse?
I think...
Yeah, we're not, I was going to say, we're not just calling ourselves, I'm not saying we. I am on the very small percentage where I went to school to become a veterinary technician. Mm-hmm. And so my title is veterinary technician. I am in a very small percentage of still believing that. But in the rest of the world, they go to school to be veterinary nurses. And so people are getting caught up with the word nursing, and it's something that is being blocked from the nurses' side, that organization, and I can't think of the name right now. I had it written down, but it's been an issue to get that title change from veterinary technician to veterinary nursing as like our program being called. So like, you guys go in for nursing, you get the bachelor BSN and bachelor's of nursing, and so like ours would be an associate's in veterinary nursing, but it's being blocked by the nursing organization for the past 10 years. And so there's been petitions to change it and everything like that to be on par with the rest of the world. But it came up recently on social media when, a technician had gone on and she's like, I am a veterinary nurse, blah, blah, blah. And someone in a famous TikTok setting said, but you're not a nurse. And so like the word is being caught up in the word nursing. I'm not going to do CPR on a human because I would not do well,
People are gross. That's why I do animals. So I have the utmost respect.
Like, you know what I mean? And so, but it's the word nursing after veterinary that people are having an issue. And I didn't want that to get lost in the context because there are very big similarities and there are very big differences. You know what I mean?
I think that, like, for example, let's say that you're at Ingalls and somebody, like, fumbles over, right, and is not responsive. If I run over there and say, I'm a nurse, and then this other person's like, I'm a nurse too, and somebody's taking over the situation and says that they're a nurse, but they're in the veterinary field, that is where I have a problem with it.
So we wouldn't do that. I'm telling you right now, like 98% of the veterinary technician people wouldn't do that because
I feel like if there was an
setting
animal in distress, I wouldn't be like, I'm a vet tech, let me help. If
somebody
knows something about animals, get your ass over here and help.
Right.
Yeah, no, we wouldn't do that.
And
we would not go to try to help a human. We'd be like, oh, what do we do?
But Joyce, on our side, we'll have nurses, human nurses, come in and tell us how to do our job. what they want, how to pull blood, what tests that they want run, because they're a human nurse, so they know what we do.
Well, and I think we get that a lot as well in the medical field.
Mm-hmm.
Like I've had family members be like, well, my son's a doctor, he's a veterinarian, he would like to speak with you about this. And I'm like,
Who gives
okay. Is your son-in-law a dentist too? Like, totally different realms of conversation.
Correct.
Yes, you have an understanding of the body system of
Yes.
a mammal, but like,
and that's a perfect way to word it, is yes, you have an understanding of the it's not philosophy, it's the physio side of, like, yes, liver, kidneys, organs, and all of that. You have an understanding of it. Two different species. I'm telling you right now, if I was at Ingalls or Publix, and someone collapses, I'd be like, not my monkey.
Right. I know the basics. I know CPR. I can, if you pass out, you faint, turn you over, all those things. But if a nurse came over there like, I'm a nurse, I'm stepping in, I'm backing up, like, what do you need? What can I do for you? I understand what you're doing, but that's your realm, not mine. What do you need? What can I give you? You know what I mean?
Yeah. I guess I don't. I'm not a sensitive person, and I'm not like territorial over my profession. I do think that there are, kind of like what we've been talking about just in this last few minutes. Of like, I would never try to take over in a veterinary situation, but I've also seen, like, checking out at the grocery store, the girl ringing me up, bless, she was telling me that she might as well be a nurse because she took care of her grandmother for several years, and I was like,
correct. Yeah.
I'm sorry. Say that louder for the people in the back. They didn't hear you.
Because I took care of my grandmother. You're like a CNA, kind of, without the C.
Even that, though. But did you take Mima's blood pressure, or did you just get her? Did you just feed her?
Right.
And that's wonderful. We need health, like caretakers of our elderly population, and the opportunity to care for your grandparents, your loved one. That's a beautiful thing. So no discredit to what she did. However, I was like, honey, you're not a nurse. You gotta go to school for a long time for that.
Correct.
Right. And that's, we can talk about differences in education as well.
So do veterinary techs have I was reading your notes too, Joyce. They typically don't have a bachelor's, but are leaning towards that direction, or
no. So it's more, veterinary tech is an associate's 2-year degree, right? They call it an accelerated program, similar to the associates in nursing, in a sense that you're going to school Monday through Friday, right? And then you can do a bachelor's. There is bachelor programs. It is not common practice unless you automatically know that you're going to want to run a practice or go further into just being a veterinary technician. There's not a pay difference, both coming out and both going into the same job, right? If you have a bachelor's versus an associate's, except the bachelor's person is going to be more in debt with school, right? And so I've known only, let's say out of 20 technicians, maybe one would have gone for a bachelor's. So it's just not common practice. They do have, and a lot of it is you go for an associate's and then you do the online for the bachelor's for another 2 years.
What type of bachelor's do you typically see with a veterinary?
I'm going to use Amber as an example because, she runs a practice. She's a practice manager right now. She doesn't have a bachelor's and it's not qualified to have a bachelor's to run it. But someone else can come in with a bachelor's and also apply. They would be technically making the same if they were both being considered. Like, the bachelor's isn't a make or break money point. It was just you would get more training, the business side of it, to run it.
So I guess that's another thing that, another difference. The education for a nurse, well, at least the RN, I am not super familiar on the LPN route, but is a 4-year degree and is healthcare start to finish. I mean, the first year you do your normal kind of like prerequisites, but then you have a certain amount of science classes. You take anatomy and physiology, chemistry, algebra, all the different things, and then you do your 2 years of nursing school. So there is quite a bit more education involved in that realm, and it's all 4 years is there are little bits of healthcare in each year.
Right.
The last two are dedicated to nursing, but the first two are not only healthcare. You have a little bit of other things mixed in there too.
Yeah, I mean, we have our prerequisites and things like that we have to meet with our maths and our sciences and things to be able to even qualify for a veterinary technology program, but it's not as rigorous as what you guys go through. In my opinion, it should be. Like, I've been in the field for 20 plus years now, and I do feel that our educational path should be as rigorous as what it is that you all go through in terms of what we need to know, and, you know, training and our clinicals and things like that, because essentially it's medicine. It's medicine. Like, we need to have more in-depth knowledge when we're going into this field, and I feel like veterinary medicine would function a whole lot better if our staff were I'm gonna get tore up for this question, or for this statement. Better educated in their positions and what they're doing, because I would say a good percentage, depending on the state, of veterinary technicians are OJT trained technicians.
What does that mean when you say that?
On the job.
Oh, got it.
Yeah.
So is there a clinical part to the school?
Yes.
For veterinary techs, how long are the clinical rotations typically, and what does that look like?
It depends on the program. So, like, St. Petersburg College, they have, you know, clinicals to where you'll have to do, like, your practicum. That's I think it's actually called work practicum, to where it'll be per semester, but it'll accompany your clinical nursing classes, your surgery and anesthesia, your emergency classes, things like that, to where you actually have to do clinicals.
So mine was actually at the end of all of that. Like, we would take in, like, the shelter dogs and do spays and neuters and things like that and learn anesthesia that route. But then at the end, before you could go into the job force, it was a 6-week practicum at an actual practice. And then you were graded on how did you do dentals, how did you do this, how did you do that. But then, like, I went to, like, a day practice and then transitioned to straight into emergency medicine. And I had no idea what I was, obviously, you never know what you're doing, but, like, you know, we didn't have, it was, you're hitting the ground running. Like, you're stepping into the clinic and you were going right into it. Yeah, you learn how they do things, but, you know, you don't get that. I don't know how many weeks, I forget, I should know how many weeks the new grads come out where they are with a seasoned nurse. And, you know, it
depends on the facility. At the one we're at, the new grads get 12 weeks, but they're in a residency program for a year.
Right. Yeah, that's unheard of in the veterinary world, and I wish it wasn't, because I think it's just a whole learning curve, right? Like, we shouldn't be able to come out of the gates running and doing CPR on a dog and cat when we've only practiced on a dummy. You know, like, we can do better and we should do better, and we market so much that we take so much knowledge from the human side and put it into the veterinary side, because you're leagues ahead of us in diagnostic treatments and things like that. But we should also be like that on actual learning base-wise, is my personal opinion on that. I went on a rant a little bit. And then here's my conspiracy theory on the whole, like, being called veterinary nurses, is that, let's say, starting out, and this isn't a correct number, but it's going to make it easy. A human nurse will start out at $20 an hour. Veterinary technician will start out at 10. Like, this just how it is. We easily make half of what nursing makes on any given scale. That's my conspiracy theory on why we're not being called nursing, because then we're going to require more money, is my conspiracy theorist. And I put that on the record because it also boils down to money. You know, we don't get into this profession to make money. I was lucky enough that, you know, I could work with what I was making and live on my own. Others people are not. But really, it just boils down to, I have a conspiracy theory about money.
And to, like, again, we don't get into this field to make money. Lord knows none of us do. But, like, the difference with you, and I feel with, like, you guys as RNs, you know one species. So much about one species, right? We have to learn all of them. Even in school, we have to learn the exotics, we have to learn the large animal, things like that. And we have to understand disease processes, you know, different, predispositions to diseases and things like that. But also, we have to do, our doctor orders x-rays, we have to do them. Doctor orders blood work, we have to collect the samples, and we have to process the labs. Same thing with our cytologies, like our microscopy and things like that, and dental procedures. We have to do dental procedures and dental x-rays and things like that, so it's all encompassing. But yet, we make nowhere near what you guys do. But you have to take into consideration too, Joyce, is we we don't participate with insurance companies and donors, and we don't have like huge corporate hospitals and things like that to actually support the amount of money that we would need to make to keep up with that field.
Well, and also you have to think about the life that you're taking care of. And I know, and I don't want to discredit at all the veterinary side, but there's something to be said about watching the life leave a human body versus the life leave an animal. I've seen both, and I've in the healthcare world and nursing, for example, we've got 5 patients, 6 if you're on a med surg floor. You're responsible for each and every one of those human lives, and that's huge. That's huge. And you lose one, and guess what? There's one waiting in the ER for you. They don't care if you get a lunch break. They're like, guess what? Your patient's dead. Hopefully the morgue has some room because you're getting another one. There is a difference in it, and this could also come from my religious beliefs too, which the value of human life is.
You can say it. It's fine.
But
yeah, get
it.
I know what you're.
It is the most important thing.
Yeah.
Don't get me wrong.
And that's okay. No, you're okay.
My dog. I think. I feel like that's probably where that disconnect, where nurses are like, well, you're not nurses, and it is because we are taking care of a human life, and that is something so different than an animal life. But I would never say that I have the ability to save an animal's life. I don't. The mental strain of losing a human is different than losing an animal.
It is, because I can't speak for you, but like I used to want to do trauma surgery. Like that was my thing when I was younger. That's what I wanted to do when I totally wrote off vet med, because I was so mad at my mom for missing everything for being in vet med. But I think that there's that value that you're talking about, a more value on human life, because it's a mother, it's a father, it's a brother, it's a sister, there's a family unit, there's a job, there's, you stand upright, you speak, you have a social life. There's so much more of excuse my lack of better terminology, but an entanglement to make that person more valued than, say, that of a dog or cat or gerbil or goldfish. You know what I mean? Like I feel sometimes too, that's where that value comes from. Does that make sense?
Yeah, but we have to think about it too. Like humans are what make our society. Like we are. Exactly. We build this world. Humans are the workforce, the brains, without humans, there would just be anyways. Yeah.
It's a hard conversation to have, right?
Yeah,
it is.
Like, you know what you want to say, but sometimes you can't articulate it because of the way you think and you feel about it, and you're like, it's just how it is.
Well, and I don't want anyone to think I'm discrediting my profession as a nurse, and I don't want the veterinary side of things to feel like I'm discrediting what they do because it's animals versus humans. I honestly, I think what it comes down to is having respect for one another's professions, and I personally I can't wrap my head around why an athlete makes more money than a healthcare professional. And if you think about it, what about our first responders? Our first responders get paid trash. It's absolutely unacceptable. Our police officers, our firefighters, our EMTs, it's not livable wages, and they're the ones on the front lines doing CPR. I've heard horror stories of what my brother is a firefighter in California, and he is an EMT, also in the Army. And the things that he's seen, I will never see as a nurse, because I don't see that first thing. They come through the ER, then they come up to the floor once they're more settled. Yes, they're sick, but and they, think about it. They start IVs. They can give certain medications. They do. They draw labs. They don't get the title of a nurse either.
No. Nope. Let's talk about the dangerous situations that these first responders are put in. Like when they respond to certain scenes, to certain demographics and things like that, the horrid dangers because my cousin's a firefighter EMT, like the dangers that they're posed with domestic violence situations and standoffs and things like that. Like we couldn't fathom any of that, and they're making way less than everybody else.
Yep. I know. I don't know for sure what the difference in pay is as a veterinary tech versus EMT, firefighter, police officer, but I imagine it's not
give me
far
2
off.
seconds and I'm going to find out.
Yeah,
Joyce is Google it.
we're relatively in the same range. But
well, and granted, I know that
way less.
the school, again, we can go back to school. RNs go to school for a very long, lengthy amount of time, whereas an EMT firefighter, they go through their courses, but they don't have to get a degree per se.
Right.
But I just don't, I have a hard time grasping, like, why just because they didn't go to school doesn't mean they're vitally important to healthcare as a whole, and we pay them the scum of our shoe.
Yeah, so EMTs make between, starting out, $16 to $22 an hour. Obviously, demographics parts will change that, and a veterinary technician is $17 to $22 starting out. So they're comparable in pay, depending on where you're actually at.
Is there such thing as like a veterinary first responder? Is that a thing?
Yeah.
Like,
yes.
What is that? What does it look like?
Some of this, yeah.
So you're from Arizona, right?
Mm-hmm.
So I believe it was Phoenix, to where they had emergency animal medical technicians. So
right.
Like your animal services personnel were, if I'm not mistaken, this is a long time ago and I could be wrong and somebody I'm sure is going to correct me, but their animal services team of first responders were certified veterinary technicians. So we don't per se, like, even in the animal services world, like from the county that I came from, we wanted to do that. Like, we were trying to start, like, even with our fire department, we worked with them for oxygen masks and things like that to respond to animal emergencies until they could get them to the proper facilities. But we tried to get an ambulance going, to get emergency animal medical technicians and things like that, but there just isn't, I don't want to say there's not a call for it, but I don't know that anybody knows how to get something like that established, you know? But like I said, I believe...
Well, they barely want to fund it for human animals.
Exactly.
Yeah.
Yeah. So,
yeah.
I mean, our counties barely want to, you know, provide funds for our animal service facilities, let alone a whole program to respond to emergencies. So if you have an animal services officer who gets called out to a dog that's been hit by a car, that animal has no hope. Very minimal at best, because we don't have emergency responders to get to the scene, to start CPR, to start an IV catheter and fluids, to give them medications to treat them for shock. We don't have that. They don't have that I don't necessarily call it a luxury, but we don't have the ability. We have the ability. We just don't have the resources to do something like that.
But also, Amber, this is a big difference, is we can't give medications without a doctor order.
The direction of a doctor. So they
a nurse can't either.
Yeah, but like you guys have a broader scope. You could be like, you can give, let's gonna say Tylenol. I don't know about Tylenol, but like you can be like, oh, I can actually give this medication without asking the doctor. We can't even do that.
No, I cannot. This is a gray area.
I was gonna say, I was like, but
so I'm going to go out. I'm going to say no.
Okay.
There are different providers. Let's just say in certain facilities, there are nurse-driven protocols where, the facility that we work out at now does not have nurse-driven protocols. And so when I was a new graduate nurse at the facility that I worked at, let's say I had a patient whose potassium was low and they needed a replacement, right? I could order potassium replacements through a nurse-driven protocol. However, the doctor still verifies that order.
Right.
And if he sees it go through, he can be like, he or she. And then there's always like, I could order Tylenol and give it to a patient if I wanted to maybe lose my license. Technically, I need to ask the provider for permission before I can just order a medication and administer that medication. I can't just go in. I have the physical ability to type in an order and say that the provider gave me that order, but, well, that's not right. Like, that's bad.
Right.
Because they go to school for a heck of a lot longer. They're doctors, so they're, like, there could be an underlying reason why that patient doesn't have Tylenol ordered. So, no, I can't just go in and order it and administer any medication without a provider order. You can as a nurse practitioner.
Yeah. Technically, you're operating under their license, basically the
Correct.
same that we are. You're operating under their direction, under their license, so you have to abide by their orders, this, that, and the other,
Yep. There are certain circumstances, you hear providers, well, don't call me for that, just do it. You know, stool softeners, things like that. Well, they'll be like, don't call me about a Senecot tablet. If the patient's constipated, just order the Senecot tablet. As somebody who struggled to pass my boards, I would err on the side of caution with that one. And if a provider gives me crap for it, I'm gonna be like, look, dude, it's my license, not yours. So yes to the Senecot or no to the Senecot. Like, I'm gonna check my boxes because I'm gonna hold my license to a high standard and know that I could be held responsible if something were to go wrong with that one simple thing.
Yeah, absolutely.
But I do know nurses who'll be like, he'll say yes, who cares?
Yeah.
Should you do that? No. 10 out of 10, don't recommend. Don't recommend. Always cover your butt and get a provider order.
Love that. So, like, in terms, too, of, like, so we've talked about a little bit about salary and whatnot. So, like, career advancements. So
much bigger.
Yeah. Like, you guys have more opportunities and options, whereas we are, like, you're either a veterinary assistant, a veterinary technician, a lead, maybe a supervisor, or a practice manager. That's our path. That's our career path right there. I know specialty emergency, like certain friends we have are like nursing managers and you know, nurse educators and things like that. But like, what does a career path look like for you guys?
Oh man, where do I even go with that? I mean, it depends on initially once you graduate, it just depends on what specialty you get hired into or what you want to work in. I personally recommend starting at the bedside. I know the bedside is controversial just because it's a very difficult field to be in, but it is the best place to learn, whether you start in an ICU or you start on a med-surg floor. Once you've gotten a year of experience, you're no longer considered a new grad, and then you're safe to practice independently in that field, in that specialty. I've only worked in geriatrics. If I decided tomorrow I want to become a labor and delivery nurse, I'm going to have to do like a residency program or some sort of lengthy training program. Well, for one, I'd have to obviously like interview and get hired. But then them knowing I have 8 years of nursing experience, not a lick of it in pediatrics, neonatal, labor and delivery, I would have to do whatever their facility policy is and get the training with another experienced nurse in that field. So like, I couldn't just take a travel contract on the labor and delivery floor, expect that to go well.
Yeah,
I mean, you can't do it, but you can switch specialties. You do have to get the training for it, and then you can go back to school. You can be a nurse practitioner. You can do that. You can be a family nurse practitioner, an acute care nurse practitioner, women's health nurse practitioner, mental health nurse practitioner. If you have ICU experience, you could go the CRNA route, the anesthesiology route. Some schools, if you have emergency room experience, will accept that into the program, but for the most part, you have to have been an ICU nurse to go the CRNA route. And then, you know, you can always, I know a few nurses that have gone back to school to become a physician. Rare, wouldn't it? I would never want to do that. But I don't want that responsibility.
Yeah, right.
That's
You can also do like the case management side too.
Yeah.
Yes,
Which
yeah,
is
you can.
Separate
And then you can
from
the administrative route. You could go.
Yep.
But then there's the whole technology route. You could go nursing informatics because, I mean, technology is ever changing, and you've got the charting systems, you've got, you know, the nurse educator route, you've got the professor route, in a clinical setting versus education in the hospital itself. So, I mean, there's a lot
of room for growth.
Yeah.
And
yeah.
Which is awesome.
To go back, to switching specialties that you have to have training choice.
Basically, I could.
Not that you get snatched from ER.
I
I
could technically go.
I'm going to show you some cool shit, but you got this.
I went from emergency and critical care, and then overnight was internal medicine, and had to learn all of that side of it on the go, on the job. Thankfully, I had a very patient teacher, and then did the same exact thing to Amber, where she went onto the emergency side, and I said, nah, come this way. And she had to do the same thing. It was on the ground, running, training, doing your own research on things afterwards. We didn't get that
I'm just
side
gonna
of
go
it.
with the thought that you thought my brain was sexy, so I had to go to IM, and you had to just nurture that. You just
That's
needed
right.
that in your environment. You know what I mean? That you knew that I could do it.
That and
Mark
her
knew
Red Bull
you could do
addiction.
it.
But yeah,
Do you
so
have to
like
talk
pretty
about that with
much
the human nurse in here? Do you
Yeah.
have to? Since
She has
you
to deal
told
with it
about
with
all
me.
the things that it's doing bad to me.
But the moral of
Recovering Red Bull addict, okay?
she is getting better.
Do we need to talk about the daily Celsius that you have?
That was okay, first off, judgy, both of you.
Woo!
Second off, it takes me hours to drink it though. Hours.
So that means your body is going through an uproar for hours.
Judgy, again, as she crosses her arms.
It's not judgy. It's
Hey,
she's
I-
a caring cross.
I have a refrigerator isolated for sparkling water, so like we all have our vices, okay?
But the moral of this part is there is a lot of room for growth and opportunities in the nursing world if you didn't necessarily want to do true bedside, if you wanted to do the true surgery route, if you wanted to do...
There's like
You know.
I mean, we haven't even scratched the surface. There's an outpatient. You could do dialysis.
Yeah.
You could do,
It's crazy.
what's the, I can't even think of what it's called. The injections.
Botox.
Yeah, but I wanted to say anesthetist, but that's not right. It's, I guess aesthetic nursing. There's a name for it.
Esthetician.
No,
No,
No?
that's
Okay.
that's separate.
It's like an anesthetist. I know what you're talking about because, like, just from personal experience, like when I had surgery,
Like
I had
cosmetic
a
nursing.
nurse, like an esthetician, right?
I don't think that's
I
right.
don't know.
It's like
Listen.
cosmetic nursing, but then, you could work in an outpatient surgery center. You can do plastic surgery. You can work in a GI clinic and assist pre and post colonoscopy. I mean, like you can work as an IV infusion nurse. At one point in my life, I was like, I'm gonna live in Vegas and I'm just gonna have a briefcase with IV supplies, and I'm just gonna give out my business card on the strip and be like, "You drink too much? You need an IV infusion? Where's the penthouse at? Pay me a lot of money to hook you up to an IV." I mean. And that's big, especially in Arizona, in like Scottsdale area. When they do like bachelor or bachelorette parties, there are nurses that literally are freelance nurses. They obviously work for a company. You can't just like get, they have to have a provider that is ordering those things. But
Right.
they show up at your Airbnb and do IV infusions, vitamins, hydration, all that stuff. And I know nurses that love that. You work your own schedule and. Crazy.
My boss sent.
There's
IV
concierge
infusion
nursing. You work for a private provider. Something along the lines of that in Arizona for a little bit, just as a side hustle. And you're going into that person's home and essentially managing their medications, ambulating them, bathing them, caring for them the way you would in a hospital setting, just in their home.
It's basically...
Endless.
I was going to say, I was like, if you can think of an avenue,
Yeah.
a nurse can do it, pretty much. Like, in a medical setting. Let me rephrase that. In a medical setting, if you could think of an avenue within that, a nurse can go into.
Yeah.
Which is awesome. Like, we don't get that. It's... You can do some cool stuff with, like, zoos and things like that, if you can get into that, but that's about it. Like, yes, we do ultrasound, CTs, MRIs, endoscopy procedures, but we do probably a tenth of what the human side does. Be that for whatever reason you go into. There was something that you had said, and so I'm going to try to retrace in my brain of what you said that I wanted to bring up because I thought it was really cool of a difference. And I know this was supposed to be the similarities and differences, but really I think we need to focus more on the differences just to prove that they're not the same. They're different. Nursing and veterinary tech, and I think that's also getting lost on social media is like, it's different. The biggest difference that I think out of everything that veterinary technicians don't have to do, charting.
Charting sucks,
We don't.
bro.
Yeah, I have taken care of probably at most 30 patients in a hospital setting, right? In one shift, in one 12-hour shift. I didn't have to chart. I had my version of a treatment sheet, which had, the vitals, taking them outside or cleaning up after them, so on and so forth, and giving medications, right? I didn't have to chart a thing on that. That was just then taken to the doctor, who then had to do the charting. Now, mind you, she's doing that on the 30 patients, but like, I've seen y'all charting. I am so glad we don't have to do that yet.
I like how you threw that "yet" in there, because I feel like it's coming.
It is coming. Like, the more softwares that come out on the veterinary side is given more allowances for actual true charting that human nurses already do. But it's, again, I'm going to use the word tenth to what you guys have to do on your patients. Is taking care of 30 patients hard? Absolutely. You're doing vitals every 2 to 8 hours. Glucose is every 2 hours, so on and so forth. But you don't have to chart that. You don't have to make notes on that.
In the nursing world, if you didn't chart it, it didn't happen.
Same for us. If it's not documented, it did not happen.
Yeah, like, we'll have to document something.
Yeah,
you know what I mean? But like,
and things like that, but not to the extent that you guys do.
Correct. Not to the extent. Like, we'll say, yes, the vitals are X, Y, and Z. The patient urinated X amount outside, ate this amount, and was quiet, alert, and responsive in the cage.
Thus amount of fluids, infused
So,
this far, patient lateral recumbency, resting easy, client communication, spoke with owner, blah, 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 here's our history, and more information, things like that, but not to the extent that you guys do. I think that takes up majority of your day, does it not? Or your shift?
Yeah, because there's a section for each, you have to chart your initial assessment, and then you've got a different area of this charting system where you put in your intake and output and your ambulation and your safety measures. Are they a fall risk? Did you do your suicide screening?
Yeah.
Did you do their belongings assessment when they were first admitted? Do they want spiritual and emotional care while they're in the hospital? It's everything and then some. And then, you have to do your nursing notes, which re-summarize all the million things you've charted throughout your whole day. You have to document every time you spoke with a provider. If you have a critical lab that you get a phone call, critical hemoglobin less than 7, you have to document that you notified the provider and what their response was and the time that you notified them, the time you got the call from lab. Like, it is really just to cover your butt, honestly, because something goes wrong 10 years from now, you get called to court for that, and you didn't document that you notified the provider of the critical hemoglobin, and there was no blood administered. Well, what did the doctor not know? Did you not notify the provider? Well, I did. Well, you didn't chart it.
Yeah,
where is it in the charting?
You didn't do it. It's not there.
Yeah.
Yeah. No, that's crazy.
So definitely a lot of liability on that front, the charting front. I never did paper charting. I've always only ever had to do electronic, with the exception of when Helene hit and we had to do paper charting.
Yeah.
That sucked.
It did, on all accounts.
Because we didn't have any process in place for a disaster like that. So everyone was like chickens with their heads cut off, trying to figure out how to document properly, and then you had to go back in and document in the electronic record what you already documented in the chart, in the paper chart.
Yeah, and like Amber, so like the system was, if we lost power or lost connectivity, you could go back X amount of hours, right? Like, it was programmed to automatically have that preset up. We went almost a week of that just gone.
That's a lot of backlogged charts to have to do.
Yeah.
Transpose. That's a lot.
I think that, I don't know if we had to do it for, like, I didn't have to go in and chart on my patient that I had a week prior, but I know that when we did get power back that day,
on those patients on the floor,
in those current patients, you had to rechart everything into the electronic system. I don't think they could have legally been like, you remember what you did a week ago?
Yeah.
What time did that patient urinate?
And how much? What color? Clarity? pH?
What color was it? You don't remember?
Correct.
What was the spec graph? I don't know. It was concentrating. But I'm sorry. So I have a question for you, and I know it's on our notes here as a talking point. About like when you're talking about having to transpose these things and then kick back to old school, like the paper charts and things like that. It's at the forefront of what we do, and Joyce and I have had multiple conversations about this. I'm sure we have with colleagues about the stress points in our job, and we talk about compassion fatigue and, you know, veterinary medicine being very high in the industries of suicide rates. We don't. And Joyce, you chime in. You work in human healthcare now, so I don't know how prevalent it is for you guys. But mental health for you guys, like the challenges that you face, the things that you go through because of the things that you see, you have to experience, and like you said, it being different. Like if we lose a patient, we lose a pet, it affects the family. But like I'm sure you've gone through so many different things that have weighed on you from a mental standpoint. And what are some of those things, and how do you deal with them?
You just shove it way down.
You just stomp it down. Just stomp it down.
Put down with a big ass pair of boots.
Unfortunately, there is not a big help for healthcare professionals as far as mental health goes, and they'll say it's Mental Health Awareness Month. Suicide awareness is important, but that's it. They put the bulletin board up, and there you go. But then when push comes to shove, and I watch somebody die, I get a phone call. Tough. The ER is exploding.
Yep.
Get that patient to the morgue, and we got another one for you. You don't get a minute, and you don't get to go into your next patient's room and say, I'm sorry about your dang chicken sandwich that tasted like crap. This isn't the Hilton, and somebody just died 2 doors down, so give me a break. Like, you don't get to do that. You have to smile and apologize, and, I'm a firm believer in boundaries with your patient. I obviously, don't disrespect your healthcare staff, but like for privacy reasons, I couldn't just be like, you know what, somebody just died and I'm having a minute, so can you quit being a turd for 5 seconds?
Yeah.
And I think that is what weighed me down the most, is that disregard for like how complacent we almost become because it's so frequent and because there's no support. Nobody comes to check on you when your patient dies.
Yeah.
No,
same. Like
they're like,
with you.
But did you put them in the bag and put the toe tag on them because the morgue's on their way up?
Exactly.
And it's like, no, hey, have you taken a minute to eat? Don't get me wrong, like our coworkers, like the nurses that we work with are great. Obviously, I would never let my coworker whose patient just died, I would do whatever I could to be like, give me your phone, go take a break. What can I do for you with your other patients? Like, you have the support of your immediate coworkers, but as far as like the administration, they don't even know when your patients die. And so I think it's kind of up to you to manage your mental health, which is hard because when you're in the deep, what we like to call at work, the deep sad, asking for help seems almost impossible. And I feel that with mental health just in general, like when you're in those dark moments, the concept of even asking for help seems out of reach when you're in those low points. So you really, I think nurses are jaded a little bit. Like, you joke about it, and we definitely have a dark sense of humor, but you wouldn't really be able to do and experience what we experience without it. But don't get me wrong, I will always get emotional when I lose a patient, and I whether it's for a few minutes to gather myself, but I think if you lose that, you're in a situation. If you have lost the ability to recognize that a human life was just lost, then
You need to leave the field.
I think so. Not necessarily. There are some people who just are stoic and maybe they process it at home. But like, I know one of our coworkers, she's worked at that hospital for, upwards of 25, 30 years. I've seen her cry, and she just will be like, yeah, my patient just died. And if you don't cry after your patient dies, what are you? Like, you just, somebody just died. Let's recognize that. And I think that's the most frustrating part too, is like, if they don't let you stop and take a moment, where does that leave us? Like,
I was gonna say it's more ignored to a certain extent because there's so much coming up behind. Like, yes, your patient died, cool. In like 10 minutes, the ER is going to call you on a case for the room next door. It's just it's ignored on both ends.
Yeah, you've got
in different regards.
Needs to be done in one room, and somebody's got these, cardiac medication, important cardiac drips that you're dealing with, that you're titrating, that you're having to check frequently, their blood pressure, their heart rate. You're having to trust that your CNAs are getting vitals. Like, you put a lot of trust in the people that you work with too.
Yeah. I mean, it's from what you're saying, like, and you know, Joyce, again, we can probably attest to this. Being, just say in an emergency medicine, we have a dog that comes in hit by car, and we're mid resuscitation. We're covered in blood. We're chest compressions, intubation, like, and the owner finally says no more, and we end up having to euthanize that pet. And the doctor comes up behind you, or the manager comes up behind you, is like, suck it up, change your scrub top, we got a puppy in room 2. You have no time to process, like, oh my god, like, this just happened. And then again, you have to have some kind of dark humor to get you through your day. Like, it's a coping mechanism that you develop. That's part of your own mental health strategy. You know what I mean? But it's and my mom said this to me a long time ago, because she's been vet med my whole life. When it doesn't bother you that you've lost a patient, it is time to move on. Time to move on. If a life is lost and it does not bother you, or you're the one behind the plunger and you had to take that life, you need to leave. And the same thing, you guys, like, we don't have a lot of support on our side. Like, we have, just as you guys go through, we go through compassion fatigue, we go through burnout, we go through those things, but where are the resources to support your veterinary healthcare professionals, your human healthcare professionals? Because we're like an Everlast bag. We take a beating every day and are expected to just pick up and be that small percentage of a population that can take those things. We have to, because we're in healthcare, because we care about people, because we care about animals. But we're people too.
Yeah.
We have thoughts, feelings, emotions, and it destroys us. Again, like when you lose a patient, I'm sure if you've got the whole family in there and they pass, and you've got their emotions to deal with, and the post-passing prep that you have to do for the morgue to come, the toe tag, the bag, like, it's stress, it's anxiety. Where's your outlet? Where's your support at work? You know what I mean? So I'm very passionate about those things. So that's why I went off on a Exactly.
You don't have to feel comfortable answering this, because I can edit it all completely out. So in veterinary medicine, and this is a huge controversy, it involves religious beliefs, the whole 9 yards, right? We can euthanize a dog that's terminal. And that is becoming, I'm not going to say more common, like there's rules and regulations. Some states are becoming more allowed to do assisted suicide, is what it's called in the human side. And other countries, I am on the side of, and like, I had this conversation with my mother, who had terminal cancer and passed away. It was something that we had discussed, because she come from a very religious background, where she didn't want to die a horrible death. And so, but she couldn't do the assisted suicide because of religious beliefs. Do you think, and I know where you stand on your religion, so this is going to be more like medical side, do you see that coming as a more common practice? Because, euthanasia is a big part in our world, and we do it as dignified as we can, but and I'm going to call it a gift, because I view it as a gift. And again, this is everybody's belief, where we can end a life's suffering. Do you think that's going to become more common practice on the human side?
I think that in a way it is, if you look at the hospice route and being able to make that choice to be comfortable at the end of your life.
Mm-hmm.
Yeah.
Which is the route my mother took. Like, she was in hospice and had phenomenal care where she was at, and was as comfortable as she could have been. You know what I mean? As a discussion point, where do you think it's just a more common practice of an actual assisted suicide on terminally ill? Not just on someone that wants to, but...
Because I'm pretty sure, I don't know if it, as far as I knew, there were 2 states that allowed assisted suicide, New Jersey and Oregon, for a very long time. And I don't know if it's grown. I haven't really looked into it. But I know that the palliative care in the hospice industry of the healthcare profession has grown a lot. And it's not an assisted suicide. It is genuinely making the end of your life comfortable and getting the quality time, quality versus quantity. And that when there is nothing farther for treatment wise, not suffering in, the pain of some of the medication side effects some of the medications give you, you can go that more comfort care out. I think that is growing. I don't know much about the like assisted suicide though.
Because it was just something that had popped in, and I obviously North Carolina isn't one of those states. The majority of the states are not, but it's getting more population or more accepted route overseas. Excuse me, like Sweden, and there's a couple of other countries that are doing it. And so, because, like, I mean, I worked on a shift where, and they were all legitimate cases, where I went through 13 euthanasias in one day, in one 12-hour shift. Yes, did that take a toll on me? When the next one came in, it would have been number 14, and I literally just said, I can't do it, and I walked away. But I view it as just as a gift that veterinary medicine can do, but it obviously there's good versus evil on that spectrum. It was just something that had popped in my head that I wanted to see if you had seen any traction in a sense of becoming more commonplace.
No,
I guess
don't.
it's the more appropriate wording.
I think my stance on it would be different than a lot of people too, just
Right.
faith-based speaking. But I haven't seen a growth in it in at least my personal experience. But I do think that being aware of like end of life care, the awareness behind it, and the nurses that are in the palliative care and hospice, I think that part of it has grown.
Yeah. I mean, my hat's off to them as well, being able to deal with that day in and day out, because, I went through it with two parents, and, like, thankfully we had phenomenal nurses on both instances.
Mm-hmm.
But yeah, it is, again, something that I couldn't do. Is to be on that side of things.
Be a hospice nurse. I've met several, and they're amazing. I just I am not great at those conversations. I'm more of like, let me give you your antibiotics, I do more than that, but like,
yeah, oh yeah,
they're really a blessing to the family and to the patient, and making the entire situation more comfortable, and educating as the patient declines what they can expect in the next. I've had comfort care patients where I've had to call the family and be like, from my experience, I think we're here. We're here. You should come now and say your goodbyes.
Yeah.
Those nurses are very good at identifying when they need to gather the family, and I think that they're gifted in that compassion for human life.
I know I took us down another deep dark path, but it had popped up, and I was just wondering because, euthanasia. I was going to say euthanasia is common practice in veterinary medicine, and I say common practice in a sense of you could see a euthanasia in a day.
That goes back to that humans versus animals thing too. I think.
Yeah.
It's both a blessing and a curse to be able to do those things.
Yeah.
Coming from somebody who's actually pushed a plunger like this for 43 animals simultaneously in one day. Like it takes a toll on you. Again, a blessing and a curse at the same time, to be able to end their suffering, but at the same time, who are we to make that decision? You know what I mean?
All right, now that I made things very dark and sad,
Thanks.
Basically, you're welcome. I think that we were able to cover a lot on just how different the profession is. Yes, there's similarities, but there's also massive differences. And it ranges on literally all spectrums. And so I want to thank you, Janelle, for coming on here and talking through everything with us. I know we went a little bit over and disappearing acts for me. But again, thank you so much for coming on a Sunday night and chit-chatting with us. And we will see everybody next week for a brand new episode. So until then, see ya!